Okay, let's get into this. We've got this incredibly detailed source guide, like 100 different insights, specifically for anyone considering microblading.
Yeah, it's pretty comprehensive.
It really is. And it's not just looking at the nice before and afters, It's a proper deep dive into the whole process, right, from the client's viewpoint. Covers everything, basically.
And that's what makes it so useful, I think. It lays out everything someone needs to know, setting those realistic expectations, preparing them for the whole experience.
So our plan today is to sort of pull out the key points, connect the dots, and just talk through that whole journey. Save you waiting through all 100 yourself.
Exactly. Because the appeal, well, it's obvious. Better brows, less time doing makeup, feeling more confident. The guide hits all of that.
Right. Those are the big draws. Points 91 to 94 cover that.
But, and this is crucial, it makes it clear straight away that getting that perfect result isn't just popping in for one quick appointment. It's a process, multiple steps, lots to consider way before you even sit down.
Definitely. And it all kicks off with, well, preparation and research. You can't just pick the first place you find online.
No way. That's step one.
So based on this guide, what exactly should people be researching when looking for a technician? It lists the usual stuff portfolio, reviews, certifications.
License experience, yeah. All important.
But there's one bit of advice about the portfolio that really jumped out. Point 98, I think.
Yes, this is absolutely key. You have to look for photos of healed results, not just the ones taken right after the procedure.
Why is that so critical?
Because the fresh look is always much bolder, darker, sharper. It settles down a lot. Seeing the healed photos gives you the real picture of their skill, how the pigment actually looks once it's healed in the skin. That's your potential final result.
Oh, okay. That makes total sense. Such a vital distinction. So you find the right person. What about eligibility? Or things you need to do before you go in?
Yeah, the source flags some things, like pregnant women should generally avoid it. And point 7 mentions stuff to avoid for 24 hours beforehand: blood thinners, alcohol, caffeine.
Why those specifically?
They can increase bleeding during the actual procedure. Not ideal.
Gotcha. And timing's a factor too, right? Probably not smart to book it just before, I don't know, a big wedding or a beach holiday.
Exactly. Point 8 mentions this. You need that healing time. You need to avoid sun, heavy sweating, getting the brows wet. So, yeah, timing matters.
And then there are forms. Medical consent.
Right, point 11. And the guide, point 12, really stresses being totally honest here. Disclose everything: skin conditions, allergies, meds you're on. It's crucial for the technician to know it's safe for you.
Okay, so homework done, technician chosen, history shared, you arrive. What's next? The consultation and mapping bit.
Yep. First, the tech takes a really good look at your face shape, your natural brow growth, all that. That's point 13.
To see what they're working with.
Exactly. Then comes the mapping. They'll use tools. Point 15 mentions string, calipers, rulers, maybe to measure everything out and draw a symmetrical outline that suits your face.
Ah, the pre-draw stage.
Yeah.
That sounds like where you, the client, really get involved.
Absolutely. Point 14. That outline is the pre-draw. And this source really emphasizes you get to look at it, approve it, ask for tweaks before any pigment goes in. Point 16.
So speak now or forever hold your peace, basically.
Kind of. It's your moment to communicate exactly what you want, make sure you're both on the same page, manage those expectations.
Good time to ask questions, too, I imagine.
Definitely. Ask about the pigments they use. Point 17 mentions organic versus synthetic. And hygiene, like confirming they use disposable blades. That's point 18, non-negotiable.
How long does this whole appointment usually take?
The source, point 19, suggests around 2 to 3 hours is typical. And yeah, just be open about your brow goals. Point 20, communication is key.
All right, mapping's done, questions answered. Now the actual procedure. What's it going to feel like?
Okay, first, they clean the area really well. Then comes the numbing cream topical anesthetic, point 21. That needs a bit of time to work, maybe 15, 30 minutes, point 22.
And then, does it hurt?
Well, the goal is no significant pain, thanks to the numbing. Point 23 says you might feel like a scratching sensation or slight pressure. It shouldn't be awful, though.
Any sounds.
Yeah. Point 25 mentions it might sound a bit like scraping or scratching, which can be a little weird if you're not expecting it.
Okay. And what are they actually doing?
They're manually creating these tiny hair-like strokes with a hand tool, point 24, and placing the pigment just into the upper layer of the dermis, that's point 26.
And sometimes they go over the same spot more than once.
Right. Point 27 says that's usually for better pigment retention, helps the color stick. They'll also wipe off excess pigment as they go, point 28.
Does the numbing last the whole time?
Mostly, but point 29 notes it might start to wear off a little towards the very end.
Okay, it's done. You sit up, grab the mirror. What's the immediate verdict?
Whoa. Point 31 says expect bold, dark, and really defined brows. Like really defined.
Maybe even a bit too sharp.
Exactly. Point 32 mentions the shape might seem too intense initially, but remember, that softens.
What about redness or swelling?
Pretty common right after, point 30 and 33. Some mild swelling or puffiness is normal. Point 34 even mentions you might see a little clear fluid, lymph fluid, oozing slightly. That's just part of the skin starting to heal.
And the absolute golden rule here, which point 35 drives home.
What you see right then is not the final result.
Yeah.
Not even close.
Okay. So begins the healing journey. How long did that typically take?
Full healing is usually around 4 to 6 weeks. Points 35 and 60 both mention this time frame. It takes patience.
And this guide breaks down the stages, which is super helpful because it can look a bit weird during healing, right?
It really can. Points 51 to 55 give a timeline. Days 1 to 2, bold, maybe a bit red. Days 3 to 5, scabbing might start. They can look patchy.
Okay.
Then days 6 to 9, the scabs start flaking off. And this is the ghosting phase. They might look really light, like the color vanished.
That sounds scary.
It can be, but it's normal, temporary, because then days 10 to 14, the color starts to kind of bloom back as the skin underneath heals.
Okay.
By week 4, point 55 says you start seeing the true settled color. So yeah, that fade is just a phase.
What else feels normal but might worry someone? Itchiness.
Oh yeah, point 37 mentions itchiness, tightness, dryness are all common. The slight scabbing or slaking we talked about, point 38. The pigment shrinking and fading a bit initially, point 56.
Unevenness.
Totally possible during healing, point 39. One brow might heal faster than the other, point 57 says that's okay. And point 58 notes temporary color shifts, maybe looking a bit ashy or gray or even orangey before settling.
And it depends on the person.
Definitely. Skin regeneration varies with age. Skin type, point 59 covers that.
So while all this is going on, aftercare is king. What does the guide say you absolutely must do?
Number 1, get detailed aftercare instructions from your tech, point 36, and follow them religiously. It's critical.
Okay, what are the big don'ts?
Do not scratch, rub, or pick any flakes or scabs. Point 43, super important. Let them fall off naturally. Picking can pull out pigment, cause sparring.
What else? Water, sweat.
Big no-nos directly on the brows for usually 10-14 days. Point 42, so no swimming, saunas, intense workouts. Point 46, keep them dry.
Makeup on the brows.
Note, not during that initial healing time. Also, avoid harsh stuff near the brows long-term, like chemical peels, lasers, point 81, or exfoliants and acids, point 48. No facials or Botox right near them until fully healed, point 49.
Wow, quite a list. What should you be doing?
Day 1, point 41 suggests gently blotting with a clean tissue if there's any oozing. And point 44 is key. Only use the aftercare ointment provided or recommended by your technician, nothing else.
How do you shower?
Keep them dry. Point 45, some people use shower visors. Also, point 47, use a clean pillowcase each night.
And long term?
Sunscreen on the brows daily. Point 82, huge for longevity. Avoid retinol skincare right on them. Point 85. And point 89 notes that keeping skin hydrated helps.
What if something looks infected?
Point 50 says contact your technician immediately if you see significant pus or swelling. Don't wait.
That healing sounds like a marathon, not a sprint. But then comes the touch-up. The guide calls it crucial. Point 40. Why?
The touch-up. Usually done 4 to 8 weeks after the first session once you're healed. It's essential. Point 61, because that's when the tech perfects everything. They fix any patchiness from healing, tweak the color if needed, add more strokes for density. Point 62, it really finishes the job.
Is it like doing the whole thing again?
Usually not as intense. Point 63, often quicker.
And the benefit?
Much longer lasting results. Point 64 says maybe 18-24 months with the touch-up. Big difference.
So skipping it is a bad idea.
Not recommended, no.
Oh.
Point 65 warns it can lead to uneven fading later. Some people, especially with certain skin types, might even need a third session. Point 66 notes.
And you heal all over again after the touch-up.
You do, but point 67 says it's usually faster. Same aftercare rules apply, though. Point 68.
Can you ask for changes at the touch-up, like minor shape tweaks?
Yes. Point 69 says you can request small adjustments, and point 70 advises telling them if you had any unexpected reactions first time round.
This guide is so thorough it even covers the potential downsides. What are some risks?
Well, if it's not done right, point 71 mentions asymmetry, or if the technician goes too deep, that could lead to scarring.
Too deep. Does that cause other issues?
Yes. Point 72 talks about pigment migration, where the color kind of spreads out, blurring the stroke, not the desired look.
And infection.
A definite risk. Point 73 if hygiene is poor or aftercare isn't followed. Allergic reactions, point 74 to pigment or numbing cream are possible too, though less common.
And how long they last seems tied to your habits and skin type too.
Absolutely. Point 75 mentions over-exfoliating or using lots of acids. Point 87 mentions vitamin C near the brows can fade them faster. Point 76 notes oily skin can cause strokes to blur over time.
Tanning beds.
Bad news for pigment. Point 88 says they break it down much quicker. Point 86 just sums it up. Fade rate depends on skin, lifestyle, sun exposure. It varies.
Who else might not be a good candidate? Any specific conditions?
Yeah, point 77 lists things like eczema, psoriasis, dermatitis in the brow area. Point 78, active acne there. Point 79 mentions people on Accutane or undergoing chemo might need to wait due to skin sensitivity and healing issues.
And the worst case, you just hate it.
Point 80 touches on removal. It's possible, but it's usually expensive and a slow process, not a quick fix.
Okay, wow. A lot to consider.
Yeah.
But let's end on the positive, the payoff the guide talks about.
Yes. Because despite all this, lots of people love it. Point 91, that confidence boost. Point 92, saving time on makeup every single morning.
The convenience, right? Point 93, no smudging during workouts or swimming.
Exactly. And point 95 makes a great point. It can look incredibly natural when done well, subtle. Point 96 even says expect compliments.
And the guide really tries to empower the client, doesn't it?
It does. Point 99 has a great message. It's your face, ask questions, feel empowered. And point 97 advises if you're not quite happy, bring it up kindly at the touch-up. That's the time for adjustments.
It wraps up by calling microblading a journey, an investment. Point 100.
Which, after going through all these details, feels spot on. It's definitely more involved than just a simple beauty treatment.
So to recap our deep dive, we've covered the crucial research phase, the consultation and mapping, the procedure itself, what happens right after, that whole healing journey roller coaster, the vital aftercare, the non-negotiable touch-up, long-term care, and, yeah, the potential risks.
It really underscores that this is semi-permanent. It demands homework up front, serious commitment to aftercare, patience. And yeah, the healing isn't always straightforward.
Reading through these 100 points, you realize it's a much bigger deal than maybe people first think. It's a significant undertaking.
And that word investment from point 100 really hits home. Not just money, but time for research, appointments, healing, patience through the awkward phases, diligence with aftercare.
Definitely. So thinking about it that way as this multifaceted investment, how does understanding this level of commitment, the research, the healing, the rules, the touch-up, how does that maybe shift your perspective on using these kinds of semi-permanent procedures for, enhancing natural beauty? Something to think about.